Bismillahirrahmanirrahim. So the concept of obesity in pregnancy is very important and it's very easy, okay? So first of all, you need to draw a table, okay? And you need to tell yourself, let me get a dark pen. Okay, and you need to divide it into like this: class 1, 2, and 3 obesity. Class 1 starts at BMI of 30 and more than that, then 35 and more than that, and then 40 and more than that. We know that. So the main numbers that you should know are the thromboprophylaxis scoring and the CHC UK MEC category. So thromboprophylaxis score. So this woman is not that obese, but she is obese. She comes to you, and then the other one is more obese, and the third one is very obese. Okay, no body shaming, but just to help you memorize a little bit of drawings. Okay, wait, guys. Okay. So this is it. Okay, now what is going to happen is that she's going to say that I am class 1, so my score of thromboprophylaxis will be 1, but her CHC score is going to be 2 UK-MEC, okay, category 2. And if you want to give her HRT, you are going to use transdermal HRT, okay? But the class 2, when she comes to you, her score, she's saying, okay, doctor, so I'm class 2. Is my thromboprophylaxis score class 2? No, we're going to say your score is still 1. Okay, and CHC score is now, it's category 3. Okay, and now when she comes up with BMI of 40 or more, then her thromboprophylaxis score becomes 2. Please guys, this is where you make a mistake. You're like, class 1 score is 1, class 2 score is 2. No, in class 2 thromboprophylaxis score is still 1. When you add a BMI of 10 and 30, when it becomes 40, only then the score increases to 2. Very important question, okay? Scoring is, something that you should know. It should be on your fingertips. And then CHC, you can make 2, 3, there's no 4. Okay, this is it. Now we can start with our story. Okay, so first of all, a woman, she comes to you. Wait. Okay, she comes to you and her BMI is right now 30 and above, and she's category 1, not class 1. What are you going to do? You're going to start 5 mg folic acid, and you're going to start this folic acid 1 month before pregnancy and continue until the first trimester. 1,000 units of vitamin D because she's in a high risk of vitamin D deficiency. Other than this, she's saying, okay, is there any issue with the VBAC? I'm previous one. You're going to say, yes, there is an issue with success of VBAC. Losing weight improves the success of VBAC. So a higher BMI decreases its success. Why? Because there's an increased risk of uterine rupture. Why? I don't know. You guys tell me the answer. But this is how it is. That the success of VBAC decreases. So you have to take individualized consent for VBAC when she reaches class 1. So which means, so 1 and above, all of these, the risk of VBAC is low. Once she enters the domain of obese, she is at a higher risk of uterine rupture and low success of VBAC. Okay? She's saying, okay, doctor, what about forceps and vacuum? There's nothing wrong with a vagina, with an instrumental delivery, right? OVD, you're going to say OVD in OT for class 1. OVD in OT. You're going to do all sorts of instrumental deliveries in OT. Why? Of course, because there's a high risk of failure. The baby might be good sized, okay? And then it's said that they need, I'm just talking about class 1 right now, okay? Now let's just jump to class 2. In class 2, you're going to say it's bad. It's bad. What is bad? B for bariatric surgery option. A for aspirin. D for Doppler. She's going to ask you, doctor, I was class 1 in first pregnancy. Now I'm class 2. Is it good? You're going to say, no, it is bad. Okay, upgrading class of obesity is bad. So B for bariatric surgery, but only when one additional risk factor is present other than a BMI of 35 or more. Okay. So it's bad, but with one more risk factor, you're going to go for bariatric surgery. Same for aspirin. You're going to start aspirin when one more risk factor is present, because this is a moderate risk factor. So please tell me, what are the 5 risk factors for moderate risk factors for aspirin? I don't have space to write. Wait. So it's a shame if you don't know this, but this is very common. This is from the NICE guidelines of hypertension in pregnancy, that when there is one high risk, you're going to start aspirin. But when there are 2 moderate risks, going to start. What are the 2 moderate out of these 5? So one of these is BMI of more than or equal to 35, first pregnancy, age more than 40, multiple pregnancies, okay, and what is the 5th month? But a family history of eclampsia or preeclampsia, okay. The 5th one is a family history. So when 2 of these is present, you're going to start aspirin from 12 weeks onwards of 150 mg, okay. And in over here, BMI is tick because she's class 2. Now one more risk, she's a preemie. She's a preemie with class 2 obesity, start aspirin. She's a twin gestation with class 2 pregnancy, start aspirin. She's a 40-year-old with class 2 obesity, start aspirin. Okay, so you must 2 of these 5 must be present, and since we're studying obesity, we're going to consider one of them as obesity and then match the other one. That's how we're going to go about it. Okay, so class 2 obesity was bad. Okay, B was for bariatric surgery when there's one more risk factor, A is for aspirin when there's one more moderate risk factor, and D is Doppler. Why? Because this class is a major risk factor for SGA. You should know the major and minor risk factors of SGA, and we know that for protocol for major is that you have to do a Doppler at 26 to 28 weeks, and then you're going to do it in this because it's a major risk factor. So bad. It's very bad, guys. And again, there are 3 letters in bad, so 3. So it's category 3 for CHC. Okay, and she is class 2, but still the thromboprophylaxis scoring is going to be 1. Very important point to be remembered in class 2 obesity. Now we're going to talk about class 3. Remember, guys, class 1 and class 2 can be delivered in a midwife-led unit. In a midwife-led unit, and if there are no other comorbidities. But once you enter class 3, that is BMI 40 and above, you need to go to a consultant-led unit, CLD, and it's there are again 4 letters over here. So now once she is class 3, the thromboprophylaxis score becomes 2, and now you need to refer to an obstetric anesthetist to discuss, because you should know about her mobilization, her shifting, and everything, intrapartum monitoring, and everything needs to be done. There's risk of pressure sores and whatnot. And bariatric surgery is now an indication, and venous access in labor. You should also do, I'm sorry, I didn't know you can see. I'm writing over here now. Thromboprophylaxis 2, obstetric anesthetist is needed, and a bariatric surgery needs to be done, and you need to establish venous access. So that for class 2, we said that it's bad. It's bad 3. That's how we remember class 2. So how are we going to remember class 3? How are we going to remember it? It's not bad, it's BAV. It's BAV, okay? What is BAV? It's BAV 2, okay? What is BAV? It's again B for bariatric surgery, A for anesthetist, obstetric anesthetist, B for venous access, and 2 is for the thromboprophylaxis score. So it's a very bad mnemonic. Bad is good. It's a good mnemonic because bad is good. Tell her that it's a bad situation. Remember that. But in BAV it doesn't make sense. So BAV 2. Just memorize it. So you should know about all of these things. Thank you, guys.